Hello everyone, welcome to my YouTube channel once again. Um, Today we're going to do preliminary concepts in pharmacokinetics 2. Okay, so in pharmacokinetics there are two ways in which drugs are eliminated by the body. The first is first order kinetics. This is the most common one, and basically first order kinetics is a constant fraction of the drug is eliminated in the body per unit of time. So the important word is a constant fraction. So it's a constant fraction of the drug is eliminated by the body in a specific time or per unit time. Then the second one is zero order kinetics. And zero order kinetics is a constant amount, whereas in first order it was a constant fraction. In zero order, it's a constant amount of the drug is eliminated by the body per unit of time. But we'll get to some practical examples and it will be easier to understand. Okay, so also you have to know what T and a half is, which is the half-life time of a drug. Basically, the half-life time of the drug is the time that it takes for the body, or the time that it takes for the drug to be reduced to 50%, reduced by 50%. So it's the time that it takes for the drug to be reduced to by 50% within the body. So if you administered 100 milligrams, it should be eliminated to 50 milligrams. Then that is one half-life time. Okay, so let's look at our first example of first order elimination. So how do I know this is first order elimination? It's because you can look at the graph, it goes down exponentially. This means it's first order elimination. So what's the definition for first order elimination again? It's a constant fraction of the drug is eliminated per unit of time. So that is first order elimination. It's a constant fraction of the drug is eliminated by the body per unit of time. So if we look here, 100 milligrams of the drug is administered. So after one half-life time, 50 milligrams of the drug is left within the body. After two half-life times, 25 milligrams of the drug is left within the body, and three, it will be 12 and a half. Because after every half-life time, 50% of the drug is eliminated by the body. Okay, so this is first order elimination. Then if you look at zero order elimination, what zero order elimination's definition again is a constant amount of the drug is eliminated by the body in a per time unit. So the graph is linear. It isn't exponential. It's zero order kinetics. Okay, moving on. Then it's a comparison between zero order elimination and first order elimination. So the biggest difference is that in zero order elimination, the half-life times isn't applicable because it's a constant amount that is eliminated. Whereas with first order elimination, half-life times is applicable due to the fact that a fraction of the amount is eliminated by the body. So that's the major difference. And also zero order, of course, is linear, whereas first order is exponential. So that's the biggest difference. You can also see a practical example. Between half-life times, the amounts of drug within the body halves between every half-life time. That's why it's that exponential curve. Whereas here it's a constant amount that is eliminated by the body, and you get this linear graph. Okay, and also in some cases, the first order elimination can change to a zero order elimination. This is normally in high doses where there's high saturation, And then when something like this occurs where first order elimination goes to zero order elimination, you call it nonlinear or dose dependent or mixed pharmacokinetics. And then there's also the compartmental model. This is just a model where the the the, um, the human body is seen as a compartment. It's also important here. We can think of the human body as an interconnected compartment. It is very important to know and understand how a drug moves through each compartment in order to understand how long the drug will be in the body. Okay, so volume of distribution, VD. So what is volume of distribution? Volume of distribution is just how the drug gets distributed, or the amount of drug that gets distributed within the body. So how do we work this out? What's the formula for volume of distribution? So the formula is volume of distribution is equal to the dose administered intravenously divided by the plasma drug concentration immediately after injection. So once again, a volume distribution is the dose administered intravenously divided by the plasma drug concentration immediately after injection. That is how you work out volume distribution. And volume distribution, the major factor that has an influence to volume distribution would be lipid solubility. Because if you think of it logically, a drug that is lipid soluble, which means non-ionized, will easily diffuse through the lipid bilayers, which means it can be easily distributed throughout the body. This means it will have a high volume distribution. Whereas a drug that is ionized, which means it's water soluble, will not diffuse through lipid bilayer, which means it won't be distributed throughout the body and will have a low lipid volume distribution. So a good volume distribution would be like 500 liters, whereas a bad volume distribution of some neurotransmitter drugs and things like that would have a 5 liter volume distribution. So you can also see volume distribution is that dose administered but intravenously, because bioavailability would be a problem, but intravenously the bioavailability is 100%, so it must be intravenously, or you must know what the bioavailability of the drug is. Okay, so volume distribution is the dose, so the dose administered intravenously divided by the plasma drug concentration directly after injection. Then this example just say 500 milligrams divided by 5 milligrams, and then you get per liter, and you get 100 liters of volume distribution. So the factors that affect volume distribution would, of course, be the biggest one would be lipid solubility, then also plasma and tissue protein binding, and then perfusion of the tissue. But yeah, this is pretty straightforward. Okay, then moving on to clearance. So clearance is the volume of blood in a specific or defined region of the body that is cleared of a drug in a specific time or in a unit of time. So let's say that again. So clearance is the volume of blood in a specific region or in a defined region that is cleared of the drug per unit of time. So that's what clearance is. So it's also important to know that clearance is independent of the dose or the route of administration of the drug. So the dose of administration doesn't have an effect on the clearance whatsoever. So let's just say the definition of clearance once again. So clearance is the volume of the drug in a specific region or defined region that is cleared of the drug per unit of time. So that's clearance. Okay. So remember that one can see if a drug is administered orally or intravenously. So how do we see on a graph if a drug is administered orally or intravenously? The bioavailability of intravenous injections is 100%. So on the graph, one would see that the biggest plasma drug concentration would be at time 0 if it's intravenously. Because the bioavailability is 100%, therefore the drug will be immediately in the systemic circulation. So one would see that it is intravenously because at time 0 the concentration of the drug would be the highest. Whereas orally, at time 0 the concentration will also be 0 due to it takes time to get absorbed. The drug takes time to get absorbed orally. Alright, so if you can also look at another oral example. So one can see that it's orally because at time 0 the concentration is also 0. So one knows it is orally, whereas with intravenously the graph would start there and it will go down like that. So that's how one knows that it's an oral. Okay, and also one can see that it's first order, not 0 order, because it goes down exponentially. As one can see, it goes down exponentially and not linearly. So we know it's first order pharmacokinetics. Okay, so bioavailability, we know what bioavailability is. It's just a fraction of the drug that actually reaches the systemic, or the portion of the drug that actually reaches the systemic circulation. That's the definition of bioavailability, and that's an F. So for clearance, how do we work out clearance? It's just the bioavailability, like in a number, not in percentage, so like 1 or 0.5 or 0.25, times by the dose of the drug, divided by the area under the chart. So divided by the area under the chart, like here, the area. That's how you work out. That's how you work out how the clearance of the drug, like the formula. And clearance, once again, let's just say the definition one more time. Clearance is the volume of the blood in a defined or specific region that is cleared of the drug per unit of time. That is clearance. And how do you work out clearance? Clearance is just the bioavailability times the dose divided by the area under the chart. Okay. So also it's very important to note that a steady state plasma concentration is required within the known therapeutic range. So if you want to treat a patient, you require a steady state plasma concentration. And what does steady state mean? Steady state just means that the amount of drug administered should be equal to the amount of drug eliminated by the body between doses. So once again, what's steady state? Steady state is the amount of drug eliminated should be equal to the amount of drug eliminated. That is steady state. It's also a small thing how you work out steady state. But let's do an example here as well. Okay, this is exactly what steady state means. So you give a patient 100 milligrams of, let's say, morphine, and 100 milligrams reaches the body. So this means it's an IV. It's intravenously because the bioavailability is 100%. Then after one half-lifetime, what's half-lifetime? It's when the drug concentration decreases by 50%. So after one half-lifetime, 50 milligrams of the drug is available in the body. So after one half-lifetime, you administered another 100 milligrams of morphine. But remember, there's still 50 milligrams of morphine left in the blood. Therefore, there's 150 milligrams of morphine left in the body. And after the second half-lifetime, this will half once again, and you get 75. And then it goes on. And then here, one will reach steady state, where the dose administered is the same as the dose eliminated. And that's exactly what steady state is the dose administered should be the same as the dose eliminated. Okay, so yeah, we also here, we use steady state to optimize the drug performance within the therapeutic range or the therapeutic window. Too high of a dose would be toxic and too low of a dose would be inactive. Therefore, smaller doses but more doses of most drugs would be the most effective due to the fact that you keep the dose, you keep the dosage within a therapeutic range or a therapeutic window. So yes, this is the completion of this video. Thank you so much for listening, and like and subscribe.